Screening, brief intervention, and referral to treatment, or SBIRT, is an evidence-based practice for reducing and preventing alcohol and other substance use in adults. SBIRT is a promising and increasingly used practice with adolescents. Implementing SBIRT with young people serves to reinforce abstinence in those who have not initiated substance use and to motivate behavior change in those who have. Brief interventions with adolescents may play out differently than those with adults. Some common challenges with adolescent SBIRT may include reluctance of the young person to talk about substance use, concerns of confidentiality, or concerns about when and how to involve parents. When performing brief intervention with adolescents, it's important to build rapport before raising the subject of substance use, and be ready with techniques to facilitate open conversation and set the stage to enhance motivation to change. Taylor is a 15-year-old student in the nurse's office for stomach aches. She filled out the CRAFT 2.1N in the waiting room. The CRAFT is a substance use screening tool validated for use with adolescents ages 12 through 17. It asks about substance use frequency and additional questions about risk factors for developing a substance use disorder later in life. Responses allow the provider to determine the level of risk, which will inform the brief intervention. In this scenario, Taylor's responses and age indicate that she's at moderate risk for developing a substance use disorder.
Hey Taylor, how's it going? I saw your team won the soccer game on Friday.
Yeah, it was a great game. I'm really excited to be on varsity this year.
That's an impressive accomplishment. It's so important to stay active. So you've been having stomach aches?
Yeah, I've been getting them kind of frequently lately.
I'm sorry you're not feeling well. When do you have these stomach aches?
I don't know, like before tests and before games sometimes.
So sometimes when we get nervous or anxious, our body reacts with physical symptoms like a stomach ache. Do you think you've been feeling more anxious lately?
Yeah, I guess I've been a little more stressed lately.
It's not uncommon to experience anxiety at this age and have difficulty coping with it. What are some things in your life you think that could be contributing to this anxiety?
Probably just some stuff at home. My parents are getting divorced, but I don't really feel like getting into it right now.
Okay, well, if you decide you're ready to talk about it, just know that there's plenty of resources and I'm always here to talk if you need to. Would you mind talking about some of those questions you answered earlier?
Yeah, that's fine. It kind of seemed like a lot of questions for just a stomach ache.
Yeah, I know, but I do appreciate you taking the time to answer these questions honestly. We ask everybody these questions when they visit our office just to make sure we're providing the support that all of our students need. Everything we discuss is confidential unless you're in danger of hurting yourself, others, or someone is hurting you, okay?
Okay.
On the screening, you mentioned that you've used marijuana 30 times in the last 12 months and alcohol 12 times. Does that sound about right to you?
Yeah, I'd probably smoke on the weekends with my friends, maybe like every other weekend, and maybe go to a party or something and drink like once a month.
When you're at a party, about how many drinks do you have?
Usually just 1 or 2 beers.
Okay, the reason I ask is because binge drinking, which is characterized as 3 or more drinks in a single occasion, can put you in a higher risk of getting into a dangerous situation. The standard drink sizes are 12 ounces for beer, 5 ounces of wine, and 1.5 ounces of liquor. You've also indicated that sometimes you use these substances to relax. Can you tell me a little bit about that?
Yeah, I mean, I guess I've just been a little bit more stressed lately, and so smoking with my friends kind of helps me not to worry so much about my parents and school and stuff.
What are other things that help you cope with stress?
Well, playing soccer definitely helps, but I can't play soccer all the time.
Yeah, physical activity is a great tool for dealing with stress and engaging with your friends, but it sounds like it might be helpful if you have some additional tools to cope with stress when you can't play soccer. Would it be okay for us to brainstorm some other coping mechanisms sometime soon?
Yeah, we could do that.
Great. Another reason we ask these students these questions when they visit us is to assess whether they're at risk for developing health issues related to substance use. Would it be okay if I share some information with you regarding substance use at your age?
Yeah, sure.
Well, first off, there's really no safe amount of alcohol or marijuana for an adolescent to consume, especially because your brain is still developing until you're about 25 years old. There's a lot we don't know about marijuana, but what we do know is that it can affect a person's mood, motivation, school performance, and lung health, which is super important for sports. And while it may feel like Alcohol and marijuana are helping you with stress in the short term. In the long term, it can lead to increased stress and anxiety. What do you think about all that?
Well, I know that I'm not supposed to be drinking or smoking and that you're supposed to be telling me all of this, but I really don't drink or smoke any more than my friends do.
It can definitely feel difficult to avoid drinking and smoking, especially when you see all of your friends doing it. I just want what's best for your health. And at your age, any substance use can be harmful. But ultimately, what you decide to do is up to you. There's just one more thing I'd like to talk about today, if that's all right.
Yeah, that's fine.
I see that you also checked yes to driving or riding in the car with someone who had been drinking or using substances. Is that correct?
Yeah, I mean, someone's given me a ride home from a party once or twice.
Driving after drinking alcohol or using drugs or getting in the car with someone who has been drinking or using drugs puts you at a much greater risk for getting into an accident. I'd like to offer you this contract for life. Even if you're not ready to quit or cut back on drinking or smoking, you can pledge to not drive or get in the car with someone who has been. Also, you can share this with a trusted adult who can commit to getting you home safely.
Okay, my parents don't have to know that I'm drinking though, right?
No, you don't have to share this information with your parents unless you're ready. The main purpose of the contract for life is to formulate a plan so that if you or your friends are in a situation where you're under the influence of alcohol or other substances, you have a plan to get home safely.
Okay, well, I'll take it home and look at it, and maybe I can talk to my older brother.
Yeah, that sounds good. I'd also like to check back in with you in a couple of weeks and see if you need any more support around your stomach aches, stress, or substance use. Does that sound okay with you?
Yeah, that's fine, thanks. My stomach's actually feeling a little bit better now. I think I just needed to relax for a few minutes.
Oh, great. We'll set up that follow-up appointment and I'll see you again in a few weeks. Thanks for taking the time to sit with me. We'll see you
Okay.
soon.
Thank you.
Even if you don't get much engagement from the adolescent, bringing up the effects of substance use on health still encourages thoughts about behavior change. It's common to have some reluctance at first, but it is important to let the young person know that you are there to have the conversation with them if or when they are ready. To explore motivation, you may discuss the pros and cons of substance use or challenges the adolescent may face when cutting back.
Hey Taylor, have you been lately?
I've been okay, about the same as last time.
Oh, I'm sorry to hear that. Well, the last time we spoke, you mentioned you were dealing with some stress and stomach aches.
Yeah, still pretty much the same. I mean, I've had kind of a lot on my mind lately. It's been a little harder to focus in school and stuff.
Yeah, stress can make it difficult for us to focus on the things that are important to us. But I remember you mentioning that your parents were going through a divorce. Do you want to tell me more about that?
Yeah, I mean, it definitely hasn't been the easiest, but I don't really feel like talking about it that much, if that's okay.
I understand. If you'd like to talk, just know that I'm here. I'd like to check back in on your substance use, if that's okay.
Yeah, that's fine.
Okay. Since the last time we spoke, about how many times do you think you've used marijuana or alcohol?
Well, I did smoke a little bit of weed the one weekend. I didn't have any games that weekend and was hanging out with my friends and just feeling a little bit more stressed about what's been going on with my parents.
Okay. Do you want to tell me some things you like about using marijuana or alcohol?
Yeah, well, smoking weed definitely helps me relax a little bit, and I think alcohol helps me kind of loosen up at parties, and it's something fun to do with my friends.
What are some things you like less about smoking and drinking alcohol?
Well, I have been a little worried lately that my coach or somebody's going to find out about me drinking or smoking, and I guess sometimes it doesn't seem like smoking weed's helping me relax as much as it used to.
So it sounds like marijuana helps you feel less anxious, and drinking helps you feel at ease more at parties. But you're also noticing that it isn't helping your stress as much as it used to. You're also worried about the consequences if someone like your coach or parents were to find out.
Yep, that sounds about right.
Although marijuana may seem like it's helping you relax in the short term, it can often lead to increased anxiety over time, especially worrying about your coach finding out. That could potentially increase stress as well.
Yeah, well, I definitely don't want to be adding to my stress or making it worse.
As your nurse, I just care about your health and well-being, and I would recommend that you avoid smoking marijuana or drinking alcohol until you're at least 21 years old. How do you feel about stopping altogether?
I don't know if I'd want to quit completely. I mean, I still like going to parties with my friends and smoking sometimes on the weekends.
Okay, well, on a scale of 0 to 10, how ready do you feel you are to cut back? 0, not ready at all, 10, meaning very ready.
I'd say maybe a 5.
What makes you choose a 5 and not a lower number like a 2 or 3?
Well, I have been feeling more anxious lately, and so now I'm kind of wondering if smoking weed might be making things worse, including school, even if it does help me relax sometimes. And I definitely don't want my coach finding out about me smoking or drinking during the season.
So you can think of several reasons to cut back or even quit altogether, including the anxiety you've been experiencing, school stress, and making sure it doesn't interfere with your soccer opportunities.
Yeah, that sounds about right.
It may take several brief interventions before an adolescent is willing or ready to make a change in their substance use. Providers can still refer to community resources or support services, such as a school counselor or an after-school group. Helping the young person address some of these underlying issues leading to substance use may help improve outcomes when it comes to stopping use altogether.
Taylor, I'd like to offer you something called an abstinence challenge. The idea with this is that you try to not use alcohol or marijuana for 2 weeks, then we check back in and I see how you're feeling and if anything's changed, as well as if it was easy or difficult for you to stop. How does that sound to you?
Yeah, I guess we could try that. I mean, 2 weeks isn't that bad.
Okay, great. I'm also wondering how you think your parents may be able to be involved to support you during these stressful times.
Well, I would really prefer if they don't know about this, if that's okay.
Okay, yeah, that's totally fine. But how about in the meantime, I arrange for you to meet with our school counselor to discuss some coping mechanisms and ways to help you work through these stressful situations. She works with all of the students here and she does a really great job.
Okay, yeah, I think that could be helpful.
Great. I'm really glad that you're interested in trying out the abstinence challenge and meeting with our school counselor. I can see that you really care about your health, and I've really enjoyed talking with you. We'll see you soon.
Sounds good. See ya.
It is important that providers continue to build rapport and engage in short, motivational conversations or brief interventions with patients. The first brief intervention may plant the seed for future change. As you continue to engage with the adolescent, you give that seed water, and eventually you may see it grow into the motivation to engage in healthier behaviors.